Kindly check the latest vital signs of room 36. Thank you.
Yes, Doc. Hey, I am Allan Dean L. Abesamis, a first-year nursing student at Trinity University of Asia. For today, I'll be demonstrating to you how to check vital signs to an active patient. This includes body pressure taking, pulse rate, respiratory rate, oxygen saturation, and temperature checking. But first, we have to check the patient's chart correctly. We have to determine the diagnosis, the condition, and the medications that they are taking. Also, we have to check if there are any special orders, such as precaution measurement, particularly the route and other specifications. Oh, let's gather now all the equipment and proceed to our patient. For the equipment, we have stethoscope, pulse oximeter, sphygmomanometer, clean gloves, digital thermometer, alcohol, wet cotton balls, and dry ones. Of course, it is important to perform hand hygiene. As a nurse, it is our responsibility to prevent our patient from infection and transmission of microorganisms. Upon entering into the patient's room, introduce yourself and identify patient. Explain the procedure to the patient or relatives and assess for readiness. Assist the patient to position comfortably and ensure adequate lighting. Don't forget to also provide privacy of the patient. By closing the curtain, it will provide the patient a sense of comfort and security. And of course, do not forget to apply an alcohol and put on clean gloves. This is to prevent the patient from any harm. Before proceeding, ask the patient for consent. After getting the patient's approval, we can continue with the procedure. In temperature checking, loosen the clothes or patient's gown from the axillary area. Clean and wipe the thermometer from bulb to stem using wet cotton balls and dry it using the dry ones. After cleaning the thermometer, we can insert it now and place arm across the body. Hold until audible signal is heard. In temperature checking, always remember to clean and wipe the thermometer from bulb to stem before and after using it. Of course, do not forget to assist your patient. And note the result that you got. In pulse rate, place the patient's arm in a comfortable position alongside the body with an arm extended and palm upward. Place 2 to 3 fingertips along the radial artery and lightly compress the radial artery to determine the strength of the pulse. After feeling, look at the wristwatch seconds and begin count rate for 1 minute. You can do pulse rate and respiratory rate taking simultaneously with fingers remaining in patient's wrist. Place patient's hand over the abdomen or lower chest. Observe the respiratory cycle, inhale and exhale of the patient. Look at the wristwatch second and begin count rate for 1 minute. In oxygen saturation, determine most convenient site of measurement, which is the finger. Make sure that the nail polish was removed. Attach sensor probe to the finger and turn on the oximeter. Leave the probe in place until readout reaches constant value. In this device, you can determine also the pulse rate of the patient. In taking the blood pressure, position the patient's arm at the level of the heart, then turn palm up. Palpate brachial artery using fingertips. Place cuff above artery by centering arrows over artery line. Position the cuff 1 inch above the site of pulsation. Position the manometer at eye level. Close the valve on hand valve. Relocate the artery using non-dominant hand while inflating the blood pressure cuff at 30 mm of mercury above when the pulse disappears. Wear stethoscope and place the diaphragm over the artery and slowly release bulb. Take note the first clear sound until deflate the last sound IDs heard and continue up to 10 to 20 mm of mercury to allow air to escape. Wait for 2 minutes to double check if necessary. Remove the stethoscope and cuff from the patient arms. You can also do pain assessment to the patient. Take the subjective cues and observe the patient's facial expression. Take also pain scale scoring. 10 is the highest and 1 is the least feeling of pain. Discard properly all disposable supplies used. Perform hand hygiene thoroughly after the procedure. And lastly, document and record pertinent observations of patient's condition noted during the procedure.